For hormone therapy, patients typically come to us. They can have a variety of symptoms like hot flashes, weight gain, loss of energy, loss of libido, among other things. And then we'll go ahead and check their labs and find out where their testosterone, estradiol, and progesterone levels lie.
When patients have first come to the office, they primarily what they're wondering about is their energy level. They're also experiencing night sweats, hot flashes, anxiety, depression, sleeplessness, the inability to have a full night's sleep without having to. They'll wake up and feel that their sleep is interrupted due to the night sweats or the hot flashes, or just the fact that they have to go to the bathroom. The problem isn't that, it's the fact that they can't go back to sleep.
When patients come in, sometimes they're nervous about having the procedure, but it's actually a very easy office procedure that only takes about 5 minutes. We basically have them come in, get them comfortable, we clean the area, add a little anesthetic to numb the area, and then make a tiny incision to insert the hormone pellets. The pellets themselves are very small. People often ask, how big are these pellets that you're putting in me? For women, they're typically getting 2 to 3 pellets, which is a very small estradiol pellet as well as a small amount of testosterone. They're both much smaller than the size of a Tic Tac. Men can expect on the level of 10 to 12 pellets, and they're about the size of a Tic Tac. The only real side effect from the hormone pellets themselves are that some people do experience some water retention and bloating. If that's the case and they're very uncomfortable, we can give them a water pill to help with that. Other than that, if the levels are initially too high for them, they really won't feel any other symptoms besides what they're already feeling when they're too low. And then as those levels come back down to the perfect level, patients will start feeling great.
What we call, after a couple of days from the procedure that it has been done, patient is followed up with 3 to 4 days afterwards, and just to basically find out how their wound is healing, if they have any questions, how they feel. And the majority of the patients feel great. There is a little bit of tenderness after the procedure. After they get the procedure done, a little bit of ice, like an ice pack or ibuprofen or Motrin, just to help reduce the swelling. But after that, they're fine. Within 5 days, 3 to 5 days, they're able to go back and resume daily life activities, swimming if they want to. But just the first couple of days, you want to avoid any hot tubs, swimming, or going into swimming pools, just because it is still a tiny incision and you want it to heal properly and well.
As well as no vigorous exercise within the first couple of days. Hormone dosing is individualized for the patient. So this is bioidentical hormone balancing, and it is for each individual patient. So each individual patient will have a consultation, they'll have their blood work drawn, and then the dosing will be for their weight and their lab numbers and the symptoms they're experiencing.
The dosing for the patients are also very conservative. We take into consideration whether patients have an intact uterus, if they've had a hysterectomy, a oophorectomy. Also, whether patients have irregular periods or they're regular. We take many things into consideration. Age, weight, height. It's done in such a way where it really is for the patient. Symptoms, levels, everything is done in such a way where it's not one size fits all. It's exclusively done and uniquely done for each particular patient.